Hi, this is Rich Sanders. Today's February 27th, 2018, and thanks for joining us for the weekly Health Law News Nugget, a summary of the most important events in healthcare politics and business from the previous week. We had two big developments this past week that affect the nation's healthcare industry from a political and business perspective. The first is that the Department of Health and Human Services on February 21st issued a proposed rule that would allow for short-term, limited duration insurance plans to be sold in a much greater scope than what the Obama administration had currently, or at the time, allowed. As of October of 2016, these short-term, limited duration insurance plans were only allowed to go for 3 months. Otherwise, they were not compliant with the PACA, and folks would have to pay the fine that's required under the law and the individual mandate at the time. Well, the Trump administration released this proposed rule last week stating a couple of things. From its opinion, number one, these PACA compliant plans that are sold on the exchanges are too expensive and don't give people a lot of options. And number two, that healthy young people are not buying these PACA compliant plans in as much volume as the Obama administration had predicted, and so they need another option. Two very different political views, two very different policy results. So we'll see where this proposed rule goes, but in the press release, the Secretary of Health and Human Services said specifically, we want to hear from young, healthy people whether this is an attractive alternative for them to pursue. Speaking of the individual mandate, when Congress and the President passed tax reform during the holidays of 2017, part of that tax reform, which otherwise didn't really relate to healthcare, repealed the individual mandate. That personal responsibility fee, as the law describes it, where folks have to pay a fine to the IRS if they don't have guaranteed coverage and a PACA compliant plan for at least 9 months out of a calendar year. Well, when that component of the law addressed the individual mandate and repealed it, state attorneys general quickly pounced and filed a lawsuit on yesterday, February 26th, in the Northern District of Texas, that's federal court in the state of Texas, where these 20 states are suing the federal government to declare that the health reform law, the Patient Protection and Affordable Care Act of 2010, is unconstitutional. The thinking is that when the Supreme Court issued its opinion in June of 2012, determining that the PACA was constitutional, the court at that time said it's an appropriate use of the taxation powers that the Congress has under the Constitution to fine folks under the individual mandate for not having health insurance. Well, now that Congress is taking that component out of the PACA, without, the theory goes, without that fine in place, then there's no constitutional authority to have the PACA in the first place. We'll see how this winds its way through the federal court system, but it's important for everybody in healthcare to know that the constitutional challenges to the PACA are certainly not done. The chickens may be coming home to roost, Bobby Boucher. We'll only see after the case winds its way through the federal court system. And by the way, one thing to watch is how the Trump administration, which is responsible for defending this lawsuit, will go about doing it, since the president and Jeff Sessions, the Attorney General, have been long on record as opposing the PACA. We'll find out more in the coming weeks, so stay tuned to the Health Law News Nugget, and thanks for joining us.